Welcome to Motor Development and Skill Learning, Chapter 8. Let me start sharing the slides. Come on. All right. So physical growth, maturation, and aging. So growth and aging change individual constraints. Genetic and intrinsic factors combine to influence our growth and aging. Again, there's certain things that you're born with, certain things that you're going to learn to adapt over your time and experiences, and they all play into each other. Okay. We do observe patterns in growth and aging, universality, patterns that hold for all humans, specificity, individual variations. And again, we all have a little bit of both for the most part. Again, you know, this is what makes science in these fields very difficult, because we can't say 100% this is going to happen, right? Can't say, 100% this isn't going to happen. And again, our experiences are going to shape those things, as well as the fact that, we have some different genetic variations as well. So we all live different life experiences, and we all have different genetic variations. Educators and therapists can make tasks developmentally appropriate. So again, how do we do that? We play the numbers, right? Again, it's not perfect, but we play the numbers. And in times that we can work one-on-one, either with children, young adults, or older adults, we can tailor things, so say I've got a 45-year-old going through something, and I'm trying to work on something developmental with them versus like an 8-year-old. The 8-year-old, there's certain things that by the numbers, we're like, okay, they should be able to do these things. These are things that we can help improve this, and it may not work. Well, okay, I can take what I know from that, tailor it for that individual 8-year-old, or tailor it for 45-year-old, or tailor it for a 70-year-old, based on what tends to work for most people. And with the difficulties and challenges I'm seeing with the individual, what can I change that might help them be successful, right? Again, and I'm talking in these terms of like helping somebody overcome something, because typically as professionals, that's what we do, right? In our fields, we're always helping people to better themselves in whatever aspect that they come in to ask us to help them with, right? And so that's what we do. Prenatal development, early development is controlled by genes. Normal development, inherited abnormal development as well, right? Certain things happen because of our genetic predispositions. A mom or dad passes on certain genes that may be abnormal development genes versus normal development genes, right? The embryo or fetus is sensitive to extrinsic factors, positive effects and negative effects. So again, if the mother is doing drugs or abusing alcohol or something, that's going to have a negative effect, right? If the mom is, eating healthy, taking care of her body as well as the baby's body, that will have a positive effect. Embryonic development, conception to 8 weeks. Differentiation of cells to form specific tissues and organs. Limbs are formed at 4 weeks. Human form is noticeable at the 8-week mark. Again, this just shows the implantation. So if it's implanted too far up, you'll see it becomes blastocystic. If it's below a certain level, you see the embryo there. Fetal development, 8 weeks to birth. Continued growth by hyperplasia, which is cell numbers, right? Again, there's the whole hyperplasia, hypertrophy. During fetal development, we have both. Once past a certain developmental point, in adulthood, there's the question of whether or not we still have any hyperplasia that happens. We at this point don't know, right? We're unable to determine that in the human species at this moment, but I'm sure when technology catches up to these questions, we'll be able to answer that at some point. Cephalocaudal, head to toe, and proximal distals near to far. Plasticity, capability of taking on new functions. Fetal nourishment, oxygen, nutrients diffuse between fetal and maternal blood in the placenta. Poor maternal health status can affect the fetus. Abnormal prenatal development, source of abnormal development can be genetic or external. Again, like we said, you can be carrying a certain genetic gene that becomes more present, and maybe you were a carrier, you didn't have it, but now your baby does. Or again, by taking care or not taking care of yourself as well, right? With like the drugs and alcohol can create abnormal prenatal developments. Congenital defects present at birth can be derived from genetic or external sources. Genetic causes of abnormal development can be caused by dominant disorders, defective gene from one parent, recessive disorders, defective gene from each parent. Can result from mutation of the gene. Effects on growth and maturation are variable. What are some genetic disabilities? Babies born with Down syndrome. You've got different types of dwarfisms and things like that. You can have two parents of normal height have that, and again, those who are developed with that, when they have kids, sometimes they may have it, sometimes they may continue on to normal development as well. So again, these are some genetic and I don't even like to say disabilities with some of those, because people live pretty normal lives with those as well. But again, there are differences, right? There are genetic differences, but again, they're usually listed under disabilities, so we'll go with that. And what effects does each have on normal growth and development? Again, they may not have normal growth. They may have altered development, right? And again, within those, so the fact is some things that are abnormal, there's enough folks that have had them, wherefore then we can now track new normal patterns for those particular different developments, right? And so again, what may not be normal to the population at large may be they may have normal growth patterns and things within now a new specified population. External causes of abnormal development. External factors can affect the fetus through nourishment of physical environment. Teratogens delivers through nourishment system act as malformation producing agents. Some teratogen effects result from too much of a substance or too little, right? So malnourishment, overnourishment, having too much of things that aren't good for you, again, such as drugs and alcohol, those can all have different effects. External causes of abnormal development continue. Placenta screens some substances such as large viruses, but not all harmful ones. Harmful environmental factors include pressure, temperature, X-ray, gamma rays, oxygen deficiency, atmospheres, pollutants. Tissues undergo rapid development at time of exposure are most vulnerable. Teratogens, what are some substances pregnant women are told to avoid? Again, like smoking, drinking, drugs. What environments or situations are pregnant women encouraged to avoid? Again, X-rays, right? And what substances or supplements are women encouraged to take? So, folic acid, a healthy amount of vitamins and minerals and so on and so forth are part of a good prenatal care package, right? Postnatal development, overall growth follows a sigmoid S-shaped pattern, talking about the spine. Timing of spurts and steady periods can vary among individuals, and timing differs between the sexes. Typically, you'll see girls grow earlier, um, pre-puberty, where you'll see post-puberty, where sometimes the boys will have longer growth spurts. That's why you'll tend to see in younger age elementary school kids, sometimes the girls are taller or they're more evenly matched, where in most adults, men tend to be taller than women. And again, that happens post secondary sexual characteristics maturation times. Height follows a sigmoid pattern. Girls' peak height velocity occurs at 11.5 to 12 years. Growth and height tapers off around 14, and it usually ends around 16. Boys' peak height velocity occurs afterwards, right? So 13.5 to 14 years. Growth and height tapers off around 17, ends around 18. And the long growth periods of males contributes to the absolute height differences, okay? Again, it's not sexist. I know some people, like to hear these things and go, it's just difference, right? So, if you're one of those folks, we're not saying boys are better than girls. They're just taller. It's just genetic. And there are some really tall girls out there too. There's some girls I've met that are, I'm 6'2", and I've met some girls taller than me, right? But in general, boys tend to be taller. So again, this shows you the difference in age of the peak height velocities, right? So it shows that girls are sooner than boys, and then the height gain change after that between the two, right? So you can see the difference in the ages, and then horizontally, and then you can see the difference in the actual heights. Individual variations, average ages for peak height velocity and tapering of growth are based on groups. Individuals can differ from the averages. In what ways can individuals vary from the average patterns? You'll have some folks, you'll have some boys that start earlier. You have some girls that may start later. You have some girls that may start earlier, so on and so forth. You may have some girls that grow through 18. You may have some boys that grow into their 20s. There's all kinds of different things, right? And then if you look at the NBA and WNBA, you've got a whole host of folks that are basically, most of them are what you'd say outside of the averages, right? There's not a lot of, I think some of the, the shortest guys in the NBA, I'm considered tall on average at 6'2". I would be tiny in the NBA at 6'2", right? Steph Curry is one of the smaller guys in the NBA, 6'3", right? Your average height of athletes in the NBA is probably like 6'6" or 6'7", right? And even in the WNBA, much, again, you got some girls in there that are like 7-footers. You got some that are 6'5", 6'6". I mean, definitely well above the averages. So we do see that. Again, if you look at other sports where being at a smaller stature, like jockeys and stuff, they're all well below average, right? Weight follows the sigmoid pattern. It's susceptible to extrinsic factors, especially diet and exercise, right? Again, people grow up and then they fill out. Peak weight velocity follows peak height velocity by 2.5 to 5 months in boys, 3.5 to 10 months in girls. Again, we tend to like to blame our weight on what we see in our families. But again, if you think about it, diet and exercise plays huge in that. If you come from a larger family, it tends to be, now again, there may be some genetic components to that. I'm not dismissing that 100% by any means. But what you will tend to find in families, like if you see a family where the parents are in fit shape and the kids are in fit shape, it's not that the kids were born with fit genes, so to speak, as much as it is, that those parents, if they're fit, more than likely they're out doing things, right? They have, their diets are probably, they don't overeat near as much. They're out being active. They probably have their kids out being active. Same thing, developing the same type of eating patterns where what we see in families that tend to be overweight and obese is the opposite of that. You find more sedentary folks who eat a lot of calories, right? And again, with that being said, is people don't like to hear that, but to me that's good news. I come from a family where there's a lot of sedentary activity, a lot of overeating, and I don't choose to do those things, right? And so that's the good news. You choose, if you want to be a different weight one way or the other, if you want to be more active or less active, it's your choice, right? And you have the choice to do that. You have the choice to make those changes if those are changes that you want to make. And that's that's important being able to own that. Okay. Again, this isn't really part of motor development, but since we're talking about this in here, I figure that's a good opportunity for anybody that listens to this lecture, that if you're struggling with being healthy, or you're struggling with your weight or something like that, just understand that control is within your abilities. And now it just takes, developing habits, developing, controls at certain points and all that. And again, it's not a, just fix it right now type of thing. It's something that takes a bit of time to develop, and may takes, seeking out some help as well, but it can be done. All right. So it's not outside of your control. It's not outside of your power. So that's the important part. Assessment of extent and rate of postnatal growth. Distance curves show extent of growth. The velocity curves show the rate of growth, and peaks on velocity curves show ages at which rate of growth change from faster to slower. Relative growth, the body as a whole follows a sigmoid pattern. Specific parts, tissues, and organs have different growth rates at different times. Body proportions change from head heavy, short-legged form at birth. When you see babies, everybody's like, babies are so cute. They're all head, which is kind of weird to me. Baby Stewie on, every time I see babies, I always think of Baby Stewie on Family Guy. Because they're just built like that. In adolescence, boys increase in shoulder breadth. So basically they get wider shoulders. Are adults all the same proportion? No. Again, some people got bigger heads than others. Some folks have wider shoulders or wider hips than others. Some are taller, some are shorter. Some folks have more straight back. Some folks have more lordotic. Some folks have more kyphotic. Again, what is that all to do with? Part of its genetics, part of its development, right? In the external environments. Physiological maturation. As children and youth become older, they grow in size and mature. Children vary in maturation rates, and it's difficult to infer maturity from age alone, size alone, or age and size together, because again, you got, what we call early bloomers, late bloomers, those that are right in the middle. When we're talking, maturation, there's, difference between both physical and mental and emotional maturations that you could also take into account as well, right? Secondary sex characteristics. Characteristics appear as a function of maturation. They appear at a younger age in early matures. Again, so, you may have, with boys and girls, they may start developing, some kids will develop more secondary sexual hair growth at earlier age versus some that are, older. Young females may go through periods at earlier ages than, like the majority of the females. You may have some that don't hit that till maybe like a year or two after as well. Some boys can grow facial beards in junior high. Some can't grow them until they're in college or maybe even past college. All those things, they come at different rates, right? Again, playing the averages, we can say, okay, you'll typically see this at this age, but you may not fall in that group. Implications of maturation rate. How should we counsel parents of an early mature and star athlete about a child's future in athletics? Again, it's, the biggest thing is to address their concerns, because again, when you have somebody that matures early, maybe there's some concern with that, right? So let's address the concern. How early is it? Is it like really, really far early? Are they basically outs? Like there's outliers, but are they an outlier of an outlier? Is it really something, that they do need to go talk to a doctor and really kind of check some things out? Or is it something that's like, it's early, but it's normal early, right? Typically, what might they expect? If they're again, if they're an athlete, what are some things that typically happen with folks that mature at that time? And that's the thing about statistics. You can look at that. Does this mean that they grew early but they stopped early? So are they going to be short? Or are they going to be this? Or they might? Those are all things that you can look statistically, right? And again, it doesn't necessarily mean that it's like, okay, well, you know because typically a lot of times some early matures are also early stoppers when it comes to like growth. So what happens? Well, they may not be the tallest. Doesn't mean that their athletic future is necessarily out of hand either, right? So again, there's that component, but then there's also a component of the amount of time that they spend developing whatever their craft. So again, it's these are weird conversations to have, because so much of the time, we like to look at, somebody's got good genetic breed, so to speak, or stock, and that plays a big part into their genetic feature, which it can. But again, there's what you got and there's what you develop, right? And those two things, to keep moving, as you move up from one stage to the next, they both, you can make up for what you got with what you develop, to an extent. And again, you can also have folks that are just, good genetic stock, but because of the time that they don't spend developing their craft, they peak, even though they have all the genetic advantages in the world, right? So those are things to look at. How concerned should we be if a young teen seems more awkward than he or she was in childhood? Again, they may still be growing, right? So again, what do? We look at the statistics. We look at, like, where are they? Do they tend to still be growing? If their body's constantly changing, their center of gravity's changing. Like every few weeks, if their feet are a different size or their legs are a little bit longer, this or that, they're constantly having to learn a new coordination pattern for a changing body. It's hard, right? It's hard. And again, that doesn't necessarily equal that like this is an issue. Now it can, but again, that's something that, like, you work with doctors that specialize in like child development and things like that, and you just see like, okay, is this something to be concerned with or not? And then us in the fitness industry, like if you're working with this particular kid in sports or whatever else, just constantly reassure them that these things do happen, but for them to get the opinions of somebody that can give them some guide or some real information on assessments, genetically and things like that, so that you can work with them to figure out, okay, well, what's the best thing I should be working with them while they're getting other assessments done as well, right? And again, this is why it's important for parents to look at things from a health team perspective rather than just have one person looking at things and trying to make the calls and the shots, right? All right. Extrinsic influences on postnatal growth. Individuals are especially sensitive during periods of rapid growth. Catch-up growth demonstrates extrinsic influences. So things that can likely affect growth during infancy, during adolescence growth spurts, like eating patterns, exercise, any major injuries to like growth plates and things like that. Again, there's dietary concerns when it comes to things. Typically, again, not picking on any particular group, but there are studies that show that vegan and vegetarian children that are born into families that eat in those habits tend to be smaller. um, in stature, like in height and things like that. So again, it might be that they're not getting as much nutrients as somebody that eats what we'd call like a typical westernized diet or something like that. So again, those are all different things that might have intrinsic influence on postnatal growth. Adulthood and aging. Height is stable in adulthood, but may decrease in older adults. Compression of cartilage pads, osteoporosis will play into losing your height. Average adult starts gaining weight in their 20s. Diet and exercise, loss of muscle mass. This is why, you've got folks that go off to college, and then when you see them later, they may be hard to recognize, right? Again, most teenagers are somewhat active. As people become adults, it's real easy when you're not being forced to be active to just choose not to. Also, again, you're now an adult. You can choose what you want to eat when you want to eat. So again, it's one of those things. As a kid, you always want to eat ice cream for breakfast or whatever, but now you're an adult. Maybe you're choosing to do that, and maybe it's not the best choice for you, right? Doesn't mean you can't have ice cream for breakfast every now and again. Probably not the best idea for every morning, but so this is data from the NHANES, and this shows men and women in their 20s, 30s, 40s, 50s, 60s, 70s on up. So from 20 to 29, you see more of the most rapid of increase in weight. From 30 to 39, you'll kind of see it reach peak, so to speak, and you'll see that kind of stay, anywhere from 30s to about 70. In their 70s, again, people start to lose muscle, like you'll see rapid muscle mass loss, you'll see osteoporosis, you'll see lack of appetite. A lot of things will happen in the 70s while you start to lose weight, right? And so again, people usually are in their peak weight between 30 to about 60s, somewhere in their 60s is where their eating will tend to decline and things like that, right? And again, it depends on the person and their level, the way that they eat, their level of exercise, and everything else. So growth, maturation, and aging summary. Prenatal development is influenced by genetic and extrinsic factors. Most extrinsic factors are influenced through nourishment systems, and growth abnormalities can be caused by genes, the environment, or both. Whole body growth follows a sigmoid pattern with timing differences between sexes and among individuals. With advancing age, extrinsic factors contribute more than individual variability. And knowledge of physical growth, maturation, aging allows parents, educators, and therapists to understand how changing structural constraints affects movements. Again, there's the percentages, and then there's the individuals. So good practitioners are going to look at the percentages of the population at large, look where their patient or client falls within those things, and look if there's any individual differences that are going on there with, either behavior or anything else that may account for some of those differences, and whether or not those are differences to be concerned about, or if those are things that are okay, Extrinsic factors become more influential as individuals age versus genetics, right? Once you get to a certain point, it's what you do more than where your genetics are at, right? And again, structural constraints often affect movement at system levels, muscular system, rather than at the whole body level. And that's it. Any questions, comments, concerns, please let me know, and I'll be happy to help you out. All right, so we'll stop recording and see you guys in chapter 9.